If you're joining us for the first time, Live Tampa Bay is a coalition of business, faith, and philanthropic leaders who have joined together with traditional frontline professionals to achieve a singular but bold goal: to reduce the number of opioid overdose deaths by 50% in 5 years. We seek to accomplish this through a collection of interlocking efforts to include advocacy, education, and collaboration across sectors. This program acknowledges that to combat this crisis, it will take all of our efforts, even if we do not think of ourselves as part of the front line of this crisis. Today, we will be talking to the business executives about the role this sector can play in helping to combat the opioid crisis. Bringing businesses into this conversation is vitally important because we know that 74% of all those who have died of opioid overdose deaths were within the prime work age population in the Tampa Bay region. So developing programs to support the behavioral health of employees and to connect those who struggle with substance use disorder to treatment and recovery is a crucial untapped strategy for combating the opioid crisis. To help us have this important conversation, we've invited Bamitra Simmons, President and CEO of the Tampa Bay Partnership, to moderate our discussion today. The Tampa Bay Partnership is a coalition of regional business leaders working together to improve the personal and economic well-being of the Tampa Bay residents. Ms. Simmons previously served as the Chief Strategy and Operations Officer for United Way Suncoast. A former banking executive, Ms. Simmons also worked as the Florida Managing Director at Mutual of Omaha Bank and held leadership roles at Wells Fargo and BB&T. She currently serves on the Board of Commissioners for the Tampa Housing Authority, the Executive Committee for the Tampa Chamber of Commerce, and the Community Tampa Bay Board. Ms. Simmons is also the chairperson for Live Tampa Bay. Ms. Simmons, I'm going to pass it over to you for the panel discussion, and thank you for being with us today.
Thank you so much, Kelly. Good afternoon, everyone. It's great to be here to help lead this important discussion today. When people think of combating the opioid crisis, the first thought that may come to mind is first responders, hospital systems, treatment centers. However, we know there's a new frontline developing. And today, which we're in National Recovery Month, if you did not know that, we're going to take a look at how the business community can help impact the behavioral health of their workforce and in turn, create workspaces that are recovery friendly. So I'm excited to present this panel to you today who cover an array of sectors, and we're going to learn a little bit more about them and hear their thoughts. I'm going to start with Anna Marie Root. Anna Marie is an experienced human resource professional and educator. She's been serving in the public education for over 31 years. Most recently, her focus has been on engaging employees through training and development programs and connecting employees with a variety of resources and opportunities. In her new role as benefits coordinator, she's responsible for providing employees with consultation services, administration, technical support for benefit-related services and programs offered by the University of South Florida. She's also serves as the main contact for the Employee Assistance Program and assists with promoting program participation. Welcome, Anna Marie Root.
Thank you.
Secondly, I'm going to introduce Susan Baker. Good afternoon, Susan. Susan is the Senior Vice President of Care Management at KEPPRO. Susan is an experienced healthcare leader with over 20 years of experience of managing and delivering healthcare services across a broad continuum of employee health and wellness programs, as well as health condition quality management services within state Medicaid programs. In her role, Susan is responsible for operations and program oversight for employee assistance programs, utilization management, case management, community health worker, and pharmacy services, covering over 50 million members throughout this suite of products. That's a lot of people, Susan. Susan's primary expertise lies in the area of operations, program management, and service delivery. Welcome, Susan, to the conversation. And last but not least, we have Dr. John Strong, who's a licensed physician. Good afternoon, Dr. Strong. He has a strong understanding of the science and its impact on physical and behavioral health. Dr. Strong served as the executive level in the insurance industry and for more than a decade followed an accomplished career as a physician. As president and CEO of Greensboro Radiology, Dr. Strong championed the conversation of Greensboro Radiology into technology company and subsequent leader in healthcare digital transformation. As CEO and chairman of Bankers Financial Corporation, Dr. Strong brings focus and commitment to social responsibility and believes it is critical to the company's overall success. Welcome, Dr. Strong, to the conversation as well. All right, well, we're going to go ahead and get started and hear from our panelists. As was stated earlier, we know opioid overdose data for our region here in Tampa Bay shows that a majority of the fatal overdoses fall within the prime age of our working population, the ages between 25 and 54 years old. On this note, and this first question is for each of you, can you give us a broad overview of how you promote a healthy workplace and how you support employees who may be struggling with mental health or substance use? And Dr. Strong, I'll begin with you.
Yeah, thank you. First of all, one of the things that I'm trying to do is to begin with awareness and education up to our workforce. So we have probably 450, 460 employees. I speak to them every Friday on various subjects, and so first and foremost, I bring mental health to the forefront, and we discuss mental health, and we talk about the issues. We talk about the issues that's going on with mental health crisis in the country and in our area in particular. Recognizing that these things are real, they're affecting our sons and daughters and our fathers and mothers, and this isn't just something you're watching on news. This is something that's impacting all of our lives. So, starting with education and awareness. Bringing to the forefront, suicide is now the #2 killer for people aged 15 to 34 in America over the last 20 years. Bringing to the forefront that Tampa Bay is the epicenter of the opioid heroin crisis, 15% above the state average and 27% above the national average. And while we recognize that these are all reflectors of an underlying mental health issue and mental health crisis. So that's #1 is on awareness. #2 is on, to our company, taking the stigma out of it, making people realize, these are things we're going to talk about. We need to talk about it openly. And these are medical conditions. A person who has an addiction disorder or a mental health issue, you're not a broken person. You're a person who needs extra resources. You need empathy. You need help, and we're here to make that happen. And then the other thing that I share with my people is that mental health, like other parts of your wellness, you have to be very, very deliberate about it. You have to be aware of your own mental health. You have to take responsibility for it, and nurture it very, very seriously. So we have discussions about, one, keeping your foundation strong, eat a healthy diet, eat good foods, drink good water. 2, regular exercise. 3, prioritize and get good sleep. But then beyond that, also be aware of your mental health. We promote things like yoga, mind applications like Headspace or Calm. And we prioritize the discussions and the awareness of mental health around the organization. So those are, I'm not sure I hit your answer, but those are the conversations. I guess the main thing we're doing, Bamitra, here is we're bringing it front and forward. We're talking about it. We're having discussions about it. We've also taken the proactively, we have buprenorphine in all of our, everywhere in our company where we have AEDs, we have buprenorphine inhalers as well, so that if somebody does need immediate assistance, we can deliver that on the spot.
No, you did. You very much answered the question. Thank you, Dr. Strong. Anne-Marie, same question over to you. What are you guys doing to promote a healthy workspace?
Yeah, thanks for the invitation to speak about that. I really appreciate it. At USF, we believe in putting people at the heart of everything that we do. And we believe that a robust employee assistance program is an important component of creating that workplace community. So USF partners with Magellan Healthcare to provide that really robust EAP program. And it's a wonderful service program designed to assist employees with personal, family, or workplace concerns and issues. So for example, some of the challenges that the EAP program can help with include managing stress, wellness topics, handling relationship issues, balancing work and life, quitting tobacco, alcohol, or drug use, caring for children or aging parents, exploring career development options, dealing with conflict or violence, working through grief and loss, controlling depression and anxiety, providing legal and financial services, and dealing with life events, just to name a few. So basically, what we try to do is promote the EAP program consistently in a very proactive way to our employees. And how we do this is we have one of our HR web pages fully devoted to our EAP program. We have videos out there that promote the use of EAP. We have monthly email communications that are going out to our employees, reminding them about upcoming workshops and opportunities. Just getting them really engaged and interested. And finally, most recently, we developed an online self-paced introduction course to the EAP program so that employees could actually go step by step, on a timeline that makes sense for them, and discover more of these areas, more of these services, more of these resources that are available for them.
Wonderful. And Susan, last but not least, how are you guys promoting a healthy workplace?
Absolutely. Well, I think Anne Marie took a lot of my talking points, but I take it from a slightly different perspective. So we run the EAP program similar to Magellan, and so we come at it from the vendor's perspective of how we can support your employees. And so when I think about what we're doing, it's a lot of what Dr. Strong and Anne Marie have talked about, of just really increasing awareness and destigmatizing the need for support. We know that individuals deal with personal problems at home that they bring to the workplace, and many of them, struggle and aren't sure where to go or where to even start. And so making sure that employees are aware that, a lot of individuals struggle and there are lots of resources available for them. And the start of the resource can be through either their human resources team or people leader that they feel safe with, but making sure that they're aware that they have a program either through their EAP, or if you don't have an EAP, through your medical plan. If you're not sure where to direct them, there are all sorts of resources available online through NAMI, through SAMHSA, through local and state helplines where you can direct people to, but letting people know that it's okay to ask for help, that a lot of us struggle with issues on a day-to-day basis, and making sure that we're promoting and educating people about where they can go to get that sort of help. If you have an EAP program, definitely working with them to make sure that you're doing monthly awareness, that you're doing regular seminars that cover a whole host of mental wellness issues, as well as treatment options and support options related to depression, to substance use. And it might not be for you. It may be for a family member that you care about, that you're worried about. And when you come to the workplace and you're worried about all those issues, it obviously distracts you from, being the best worker that you can be on a day-to-day basis. And so just tapping into all those resources and making sure that it's visible and front and center. And it's okay to have those conversations. I know sometimes it doesn't feel like it's okay to ask somebody, how are you doing today? You look like you're having a tough day. Is there anything I can help you with? Opening the door and having those conversations, just knowing that you've got those resources at your fingertips that you can direct and support people to those programs.
So each of you have kind of mentioned the importance of, education and awareness for employees, making sure that they know where the resources are, the web links, the trainings around the employee assistance programs. But in reality, there's a big fear for a lot of employees that by utilizing their EAP programs, that their jobs are going to be impacted, and so that can sometimes prevent people from getting help. Can you guys kind of talk a little bit about the privacy around EAP and the employees having the confidence to utilize the services to get the assistance that they need?
Yeah, absolutely. Maybe I'll start and then just I can take it from a vendor perspective for sure. when somebody contacts us, the program is 100% confidential. We do not share anything back with the employer who contracts with us on, who the individual is who sought help and what sort of help that they're looking for. Obviously, as a vendor, we do have to provide information back on the number of people that we've supported. So, typically we'll say, we provided support to 10 individuals in the month, and the types of problems that we helped with range from X to Z, but we never provide information on, I spoke with Dimitra and this was her issue. All of that information is confidential and it's held confidential. And I think that's really the cornerstone of making sure you have a successful EAP program, really a successful behavioral health program. You have to make sure that employees and members understand that the information that they share with you is confidential, just like anything they share with a physician is confidential, and that I'm not able to release that information without their written consent. And so we make sure that we share that with every individual who contacts us through our call center. We make sure that all of our counselors who see employees provide that overview before they even start their sessions. And then when we do trainings, when we educate the workforce about the EAP program, we make sure that that information is also front and center, because individuals will not want to use it if they don't feel that they're protected from that confidentiality perspective. I think you're on mute.
Thank you. Anne Marie or Dr. Strong, anything you'd like to add to that?
Oh,
No,
Susan, really. I'm
agree.
sorry, Dr. Strong. Go ahead.
I think confidentiality is the critical component there as well. So we take that very seriously and make sure our employees realize that anything that they share will and always has been and remains confidential.
And to just echo what Susan and Dr. Strong shared, use of the EAP program at USF is not reported to USF in any way. It's not maintained in any type of personnel file. I think Susan already mentioned this, that an exception would be if you do consent to share information, or perhaps if something were shared that Magellan would be required by law to report. So, for example, in the case of some type of duty to report child or elder abuse or threats to commit self-harm or harm to others, then of course that's the exception. So
fair enough. No, that makes a lot of sense. So one of Live Tampa Bay's top priorities is to decrease stigma. And we know that stigma really impacts employees who may want to speak with an employer about substance use. So let's shift our focus over to you, Dr. Strong. You have implemented some practices to strengthen behavioral health within your business, and those practices can decrease stigma and encourage the health and well-being of employees. Can you share with the group about your overall approach to ensuring the well-being for your employees?
Well, first of all, I want to do everything I can to prevent somebody from dying unnecessarily. So I recognize that, the heroin and the opioid epidemic is real, and, we likely have to use people who are users that work for our company as well. So I think it's very simple to actually get buprenorphine on site and put it in location and educate people about where it is and how to use it. So first and foremost, taking care of people and making sure nobody dies here unnecessarily. And then from that, I think we just get back to addressing the core issue, which is helping people address and be mindful of their mental wellness, and helping them keep that in as much check as they possibly can. As far as other initiatives that we're involved in, it doesn't go beyond regular education, regular discussion, engaging people in healthy activities, meditation, et cetera, and so forth. So I don't have anything beyond that other than ongoing supportive care and helping keep these people as as well as we possibly can. As both Anna Marie and Susan alluded to, also making sure that our employees are engaged at work. All of these issues existed before the pandemic. The pandemic accelerated and magnified it all. So clearly, I think there's a human need for people to have connection, and that human connection is a very important part of one's overall wellness. So when people come to work, we try to make sure that people are engaged. We're working collaboratively. We're trying to we do fun things at work. We have ice creams on Wednesday afternoon for the whole company. Everyone has ice cream together. So we try to just introduce some of these fun things back into people's lives and look at a very holistic approach. I guess the other thing I will mention is, and we're hitting on it, is just the no harm and driving by example, how incredibly important it is to teach and demonstrate the need to be empathetic and kind to everybody at all times. So we recognize that we're all vulnerable. We all carry around heavy burdens, and to share that with people so that people can always be mindful of treating others with tremendous empathy and kindness is essential.
Sure. And we have a question in the chat, which I think is a great one. It's from Rita Lohman. Good afternoon, Rita. And it says, this is so awesome. This is a great question. The whole family is affected by mental health issues. So how can a company assist associates who are working with a family member who has these issues?
Yeah, I'm happy to jump in here. So, many times people just don't even know where to go, right? So you're dealing with a family member who, has a substance, is misusing substances, or maybe experiencing depression or anxiety or some sort of mental health condition. And oftentimes what we hear, at least on the front lines, is that I don't even know where to go. I think I need a psychiatrist. And so that's the first place, nothing against psychiatrists, but oftentimes people just don't even know where to start. And so we'll get a phone call from somebody that says, I need a psychiatrist. And as we're talking to them, they've never been in treatment before. Maybe they're struggling with depression. Maybe they have anxiety. And the first place to start maybe isn't the psychiatrist. The first place to start is, let's get you an assessment with a mental health professional and really understand what your needs are. And then from there, we can help you engage in those right levels of treatment. And so, really making sure that when that employee contacts us, we understand, is the issue for themselves or a family member. EAPs are frequently available to family members, not all, but if the EAP program is available to the family member can contact us at any time. And again, we'll help them do that initial intake. We'll get them connected typically to a counselor who will see them face-to-face or virtually to do that assessment, and then to help us understand, okay, here's where I think we need to go. EAPs are designed to be more short-term in nature. And so our goal is to, if we can resolve the issue within that short-term period, work with them to resolve it. But if it's going to be long-term or treatment, we want to help them get connected to that right level of care. And people just don't know where to go. And so part of our role then is then working with the local professionals, if they do need ongoing long-term care, to help them get those appointments. So making that referral to a behavioral health specialist if that's what they need, getting them connected to a psychiatrist if that's what they need, and then following up to make sure that they actually went and were engaged. Because what happens is people slip through the cracks. They'll contact us, they take a phone number, and then, if we don't follow up, oftentimes we see that they didn't make that next step and make that phone call. They need support to make that next step. And so part of what we then do is make that follow up, make sure that they got connected. We'll warm transfer them. We'll offer to help them make the appointment, because we don't want anybody to slip through the cracks.
I think that's so important about the follow up and making sure that they take that next step. Anne Marie or Dr. Strong, anything to add to that?
Yeah, if you wouldn't mind, I just wanted to really kind of drive the point home that Susan was just making. USF's EAP program is open to both the employee and household members, and offers both in-person and virtual therapy options. And each member can receive up to 3 prepaid counseling sessions per issue per 12-month period. So USF does encourage and open the door for household members to receive, services and get some very needed support as well.
Good deal. Dr. Strong, anything you want to add to that?
Yeah, we have similar programs for our employees as well. I might mention the 988 emergency mental health number. I don't think it's widely known, but I think we need to get the word out and need to start educating that 988 is now the 3-digit mental health crisis that somebody can call to hopefully quickly de-escalate a problem, and also to connect an individual who's in a moment of crisis with resources that they need. As we've alluded to, part of the problem in addressing these issues is you have resources that are trying to cover them that may not be the right resource. So commonly that's going to an emergency room, or that's going to the police station, or even the fire station. So you have other emergency system personnel trying to plug this area, and I'm hopeful that the this mental health hotline can actually address it more appropriately and be impactful.
Good deal. And I'm sure a number of the folks that are on today, their organizations and their businesses offer EAP programs and whatnot. But can you guys, each of you, perhaps provide some best practices or simple, as I like to call it, Fisher Price tips that the businesses can do to make it more comfortable and easy for the employees to access those tools? Because I think a lot of times companies have the tools, but the employees may not know and feel comfortable doing that. So any best practices or Fisher Price tools you can share with the group would be really helpful.
If you don't mind, I'd love to take a moment to address that question. Something that USF recently launched is called the Employee Success Center. And it's a tailored one-stop online shop for employees' whole person growth and development. And I believe it was Dr. Strong a few moments ago talking about creating that sense of belonging and how important that is for our workplace and our workforce community. So this is the Employee Success Center was the place where we try to bring all of those aspects in. So looking at whole person development, whole person growth. So what we've done through the Employee Success Center is really connect our employees. Again, here's another opportunity to connect with the EAP program. But in addition to that, we're also helping them connect with LinkedIn Learning courses. So there's videos, there's resources, there's all types of courses available to them through LinkedIn Learning that gives them instant free access to a variety of resources that can very effectively touch on stress relief, work-life balance, and other topics of importance that we know our employees really need the support in these different areas. So the Employee Success Center is another way that we're bringing in that positive vibe around, support and resources and that sense of belonging.
Very good. Susan or Dr. Strong?
I would definitely agree. I think, if you have an EAP program, working with your vendor to make sure that it's as visible as possible. Oftentimes when an employee or family member needs the service, it's just in that moment. And so you don't want to be like scrambling, where's the number? How do I find it? And so, trying to keep it as front and center as possible, having a monthly webinar that you push out to your employees, typically that's usually included as part of your EAP program. And it can be something, as basic as, childcare camps and support to, dealing with holiday stress and depression. And so, having something that's regularly scheduled that is visible out there to the employees so they know, on the second week of every month, I'm going to get the update on when this webinar is going to come out. Oftentimes we hear people really look forward to seeing those and knowing what the next month is going to cover. I think also just making sure that, people know that it's okay to, if they're not sure where to go, that they can reach out to you and ask for support and guidance on who to contact. The EAP covers so many issues typically, not just issues that are tied to, addiction or mental health. And so oftentimes it could be family stress. And so trying to create or generate support before an issue escalates to something that, becomes something that's, really impacting your performance at home and at work, tapping into it early so they know if I've got a relationship issue at home, if I've got an issue with my teenager at home, they can start early. They can reach out to us. We're there for them at the beginning of a problem. They don't have to wait for the problem to get, so big and impactful that it's beginning to, impact their performance at work. And so, just making sure that people are aware of all those services and the broad spectrum of support that's available, that it doesn't have to have reached a point of crisis before they reach out to us.
I think that's such an important point, that the employee assistance programs really do run the gamut, and you don't have to wait until you're in crisis to reach out to get help. I think that's a wonderful point. Dr. Strong?
Yeah, first of all, Anna Marie, I'd love to learn more about your program. It sounds exciting. So we're always looking for ways that we can continue to improve. I would put this in the category of the same thing that makes for a successful marriage and a successful family is open dialogue. So you have to have open dialogue. And so we'll continue to lead with open dialogue and discussion, putting it front and center. The playbook again is engage your employees, get your employees engaged, make sure you're connected to them, empower your people to reach out to other people, to let them know, hey, let's take care of each other. So while we're not seeing each other in the building, let's stay in touch. Let's reach out to each other and stay connected, as we know that that's important. And then the programs that and then to reiterate again, the programs that I think are healthy for our employees, employee wellness programs, we support those. Gym memberships, we reimburse those. Continuing education programs, we reimburse those. I'm personally a huge advocate of meditation. I think it's super important. It creates tremendous mind-body balance. We educate our employees about that. And as I mentioned, we're making those apps available to our employees.
That's awesome. So we've heard everything from promoting education and awareness, the employee assistance program, 998, open dialogue. And so now I'm going to turn it back over to Pern, and she's going to share with us a remarkable story about how stigma was combated firsthand by a regional organization who supported their employees. So.
Hello, everyone. This is Parnia. I'm so excited to introduce Ashley Howard. Ashley is an 11-year registered nurse at Advent Health Wesley Chapel. She graduated with her Master of Science in Nursing in 2019 at American Sentinel College with a focus in nursing leadership. She has worked at Advent Health Wesley Chapel for 7 years and was promoted to the clinical education manager in 2019. Ashley currently oversees the hospital-wide education for all employees, clinical and non-clinical. She is the chair of the Advent Health Wesley Chapel Substance Misuse Task Force and collaborates with both clinical and community partners to focus on education, awareness, and resources for anyone suffering with misuse. So I'm going to go ahead and share my screen and share Ashley's amazing video, and we have her here as well to answer questions in the end. So bear with me while I share my screen.
Mr. Parnia, we can see oh, there you go. We could see the whole screen and not just the video that time.
Okay.
There we go.
All right. Can you all hear?
No.
All right. All right. There we go.
At Advent Health Wesley Chapel. Hi, my name is Ashley Howard. I'm the Clinical Education Manager at Advent Health Wesley Chapel. I want to thank Live Tampa Bay for giving me this opportunity to share with you these next couple minutes on my journey in sobriety and how Advent Health has supported me. I have been sober from alcohol and benzos for the last 3.5 years. I can remember the call that I made to my manager and director at the time when I was admitting myself in voluntarily. I had a fear that I wasn't going to be supported, that I was going to be let go. I wasn't really sure how I was going to pay for my treatment. But when I called them, they embraced me like family. They told me, Ashley, it's okay. You're going to be okay. We're so proud of you for getting the help that you need. They never questioned my work ethics. They never made me feel any different than just being me. They allowed me to take the time off that I needed to heal. They even convinced me when I tried to prematurely come back to take a couple more weeks off to make sure that I was 110% because they knew the environment that I was coming back into was stressful. Prior to me being admitted into treatment, I had given them my 5-year plan, which was to grow in leadership. So I assumed that that might have been, just ruined because of the stigma that I had on myself and being in recovery. But I actually found that it was completely opposite. Advent Health poured into me. They accepted me for who I was. They allowed me to share my story. I was quickly and easily, I was still promoted to an assistant nurse manager that was offered to me before I went into treatment. And then within 6 months, I had applied for my current position that I have now. And I remember in the interview when I was sitting there and talking to my current boss and letting her know my priorities and, my concerns and that my sobriety was my number one and work-life balance. And they reminded me that that is also their number one priority. And that, at any time I needed help or resources, they had those for me. They embraced me like a family. They are my family. I wouldn't have gotten through these last 3.5 years without them. They've allowed me to share my story. I'm the lead of our substance misuse task force. I continue to share resources with our community, and because of Advent Health and their support and love for me as a person and as part of their family, I am where I am today because of them, and I'm so thankful for them. Thank you. Have a wonderful day.
Thank you so much, Ashley, for your strength and courage. So, what advice do you have for others who may be in a similar position that you were once in?
Well, thank you, everyone. That's actually the first time I watched that video back. So it still gave me goosebumps, and I'm so excited to be here today with everyone. And I've already learned so much just from the previous panelists, and I'm excited to take what I've learned from them into my substance misuse. But, I think for me, when I was going through what I was going through, which was really a dark time, and at the time, this is pre-COVID. So the stigma, it's still it's pretty heavy. And, even some of the nurses that I've talked to regarding this and just in my sobriety and my recovery, they're more afraid of what others will think of them. And as nurses, our patients look at us like we have our life together, right? We have the answers to everything. And so when I was making that decision to go into treatment, because I was at a point where, I was done, I didn't want to live anymore. And so I just remember thinking to myself, what are the doctors going to think of me? What is my staff, my managers? And so when I came back, I remember, and I'll never forget this, a physician looked at me and he had said, where have you been? And I told him I'd been out for a couple months, and he had just said, well, it must be nice to be on a vacation. And as much as I would have loved to have considered my, my sobriety journey a vacation at the time, I looked at him and said, actually, I'm sober now. I have been combating alcohol and benzo misuse. And he looked at me and he said, oh my gosh, Ashley, it shows that someone in recovery someone suffering with misuse, depression, anxiety, there are no faces. And he's not wrong for that. You know, just because I was a nurse and I have an apartment to live in and I had a job or have a job doesn't mean that I'm not going through something. And so that's what I want to continue sharing and reminding people that come to me and they ask me for support. And I think that's why when I did decide to get sober, I asked my company, Advent Health, can I share my story? Because I think it's okay to be not okay, right? And so I love to just remind not just nurses, but anyone else that I've come in contact and shared my story with that, you know, you're not alone. You're not alone. And if I can get through this, you can get through this. And I'm just blessed that I work for a company that has supported me in every step and has, you know, been my rock. So.
Thank you, Ashley. I have goosebumps. That was truly remarkable, and thank you for your openness and sharing your story. I think that's what we need, and that's how we break down the stigma, is by talking about it. So thank you.
Yeah, of course.
I now want to open it to our audience for questions. I know we have a couple in the chat, so feel free to insert any questions in the chat, or feel free to raise your hand and unmute. I do see one. All of what you were saying is great, but nearly half of Americans work for a small business that has no tangible resources or the organizational funding to help employees, such as with an EAP and gym memberships, other than SAMHSA hotline numbers and NAMI. So what can a small employer do? I'm going to open this to all the panelists.
One of the things that I know, just in working with some small employers. So, you know, we support some small employers through, you know, if you carry insurance, either short-term, long-term disability, if you carry health insurance, sometimes there's an EAP program that's embedded as part of that program. And so I would definitely encourage you. There are lots of small employers that we support that are part of a consortium, if you will. And so oftentimes you're not necessarily aware that that's part of what's available through your program. Sometimes it's included in a dental benefit. So I would just encourage you to check to see if that's something that might be available through any of those programs that you might have, as you know, they typically call it like a free EAP that's available through those services. So. In addition to that, I would just say connect with your community, your communities. There are so many programs that are available in each of the communities of, you know, that offer support. You know, the 988 line is certainly a place that, you know that we support and educate people about. But there are also, you know, kind of local mental health agencies, that nonprofits that also work with employers. They also are invested in getting the word out and destigmatizing. So I think as you are in your local community to, you know, identify those, I know they're oftentimes willing to work as well to help, you know, create free programs and create, you know, information that you can distribute to your employees as well.
Thank you. Do we have any other questions? Feel free to either raise your hand or go ahead and put it in the chat. I'm going to read some of the comments that I see. It's okay to not be okay. That is so true. They said it resonates with me. Sometimes I just don't want to and can't put the cape on for my own mental health. And then Ashley Neal said, good recovery resource starting points are recovery community organizations. We have one in Hillsborough County, Pasco County, and Pinellas County. So thank you for that, Ashley.
I just want to add quickly to Karen's comment. I'm happy to provide some of those local resources too. I'll put my email in the chat. I have a list of those local RCOs if anybody is interested in all of the various counties around the region. And I'm happy to assist with some of those questions after the webinar. So I will go ahead and put my information in the chat.
And if we don't have any other questions, Kelly, I'm gonna hand it back over to you.
Yes, sorry about that. I just wanted to get my information in the chat. So I just wanted to say thank you to all of our panelists and speakers and to all of you for joining us today and discussing the importance of providing support in the workplace. I do want to say a special thank you to our moderator, Ms. Bimitra Simmons. She did a wonderful job. We know that employers are an important point of contact for employees who may be struggling with mental health or a substance use disorder. Implementing the strategies and practices heard today can be crucially important in combating the opioid crisis. You will see a link to the survey in the chat that I put in the chat a few moments ago. We hope you'll take the last couple of minutes to complete it. And we think your input is very valuable to our discussion and in these webinars that we have in the future. Our next Link Lunch and Learn will be held on October 18th from 12 o'clock to 1 o'clock p.m. And we hope you can join us again then. So thank you, everybody. Thank you, panelists. Thank you, audience. We will see you next time.
Thank you.
This is Eric.